I'm the Community Resource Specialist here at Families Helping Families of Southwest Louisiana. We're pleased to welcome you to our webinar this morning, Social Security Benefits for People with Disabilities. I want to make you aware that this webinar is being recorded. Before we begin today, I want to introduce you to my coworker, Ms. Melinda Elliott. She wants to take just a few minutes to tell you about a very important program here at Families Helping Families of Southwest Louisiana.
I had to remember to unmute. Thank you, Davelyn. So, my name is Melinda Elliott. I am the LeCan team leader for Region 5. I cover Calcasieu, Cameron, Jeff Davis, Allen, and Beauregard Parish. Exactly like the Families Helping Families of Southwest Louisiana Center covers. LeCan is a statewide grassroots advocacy network, though. There's somebody like me in every part of the state. We link lawmakers, people with disabilities, providers, family members, people that care about people with disabilities, to each other to make positive change in systems that serve people with disabilities. And we advocate for policy and systems that support inclusion everywhere people learn, live, work, play, grow old. We advocate for systems that support kids and adults with disabilities to live in their own homes and be fully included and participating members of their local communities and their schools and activities that they want to be involved in. People like me, team leaders, have a regional team of advocates. So there's a little bit over 700 people on our regional team. And everybody does different things. So some people tell their story, some people send emails, some people make calls. But as a group, we're an awesome group. But there's a group like this in every area of the state. Now, the leaders provide information on proposed policy changes and how those changes affect people with disabilities. We also do training and skills to effectively advocate for systems change. So I do trainings with the Families Helping Families Center. I do membership meetings where I provide training. I do that in a variety of ways. But the most important role that I believe that I have is linking people with disabilities and people that care about people with disabilities to policymakers, legislators, VESI members to tell their story or to tell their views. The policymakers get tired of hearing from me. They want to hear from people, their constituents, people in their area. And we just recently agreed, the Louisiana Developmental Disabilities Council agreed on a legislative agenda. So I'm going to read it from my phone. There's only 4 points to it. I'm excited because it was like last week. This is the first time I actually get to say what we're going to be working on this legislative session. So, number 1, cameras in the special education classroom and data and accountability around cameras in the special education classrooms. We're going to clean up some of that language in the law that we helped get passed last legislative session. And then the Schedule K exceptions, particularly family members, the legally responsible family member as paid caregivers. I'm sure some of you know that that's possible because of the pandemic and the hurricanes, but that's going to go away at some point. There's a group of people that are interested in keeping that. And then the third is funding for comprehensive dental for adults with intellectual disabilities or developmental disabilities. And then fourth is supporting LaPaz legislation to fund post-secondary programs. These are programs for people with developmental disabilities that allow them to be able to go to college and participate in that activities in that stage of life. So I'm really excited about those. If you're interested in any of those or interested in uh, people with developmental disabilities and the issues around those disabilities, it doesn't cost anything to join. You can go join at the link on this slide, www.lacanadvocates with an S, all one word.org. Really, all you're doing is agreeing to get the emails. I'm hoping you're going to gain lots of information, send emails of your own, make calls, possibly tell stories. But I'd appreciate your joining. And Wallace, my coworker, is putting the link in the chat box if you need it. If anybody has any questions, let me know.
Okay. Thank you, Ms. Melinda. I would like to take a moment to review some housekeeping items with you before I introduce you to our speaker. All participants will be muted during this webinar. If you're having difficulty hearing, please send us a message in the chat and we'll do our best to figure out how to address the issue for you. If you are disconnected for any reason, please call in using the telephone number in the email you received upon registration. Our presenter will be answering your questions at the end of her presentation. Please send those questions by entering them into the chat. We'll be recording today's webinar. You can find the recording on the Families Helping Families YouTube channel if you search FHFSWLA. Please consider subscribing to that too. After this webinar, you'll have the opportunity to provide us with feedback about the experience. We value that feedback and would love to hear what you thought about today's webinar. Without further ado, I would like to welcome our speaker, Maria Alvarez. She's a public affairs specialist with the Social Security Administration in Louisiana. She did a similar presentation for our staff. She is very knowledgeable and we just look forward to hearing the material that she has today. So welcome, Ms. Maria.
Thank you, Dave Lynn. My thanks to Susan at Families Helping Families for inviting me to share our program information with you. And my thanks to Dave Lynn for coordinating the logistics. And my thanks to Wallace for helping us with the technology. Let me go ahead and get my presentation up here. And we will get started with some good information on our programs. All right, can everyone see my screen?
Yes, ma'am.
Okay. Thank you, sir. All right, everyone. As Dave Lynn said, my name is Maria Alvarez. I'm with the Social Security Administration, and I have a wonderful job with Social Security. I get to educate the public about our programs, whether it be disability, retirement, or any other aspect of our program. So with that being said, let's go ahead and get started. There is a lot of confusion between our disability characteristics, but they also have a lot of differences. What they share alike is that they both pay monthly benefits to people who are disabled. They have the same definition of disability. So if you are found to have a disability that meets the Social Security disability criteria, whether you file for SSDI or SSI, it's going to be benefits. Both programs are also administered by the Social Security Administration. So They do have some differences, though. They have very different non-medical criteria, and we're going to get into those details in a moment. The other difference is that if you're approved for SSI, you are eligible automatically for Medicaid here in the state of Louisiana. That's not if you're approved for Social Security disability, you are entitled to Medicare after 24 months of being on our rolls as a beneficiary. For certain conditions that you are approved for, you do get Medicare automatically. Those tend to be conditions that are fast progressing and tend to be terminal in most cases. Why are some conditions approved automatically for Medicare? Because of those reasons, that they are fast progressing and are terminal. And there are some that might not be as fast progressing, but they've had some good lobby in Congress. So FYI about that. By the way, SSI is Supplemental Security Income. You're going to see the initials SSDI, that's Social Security Disability. And we're going to get into more of the specifics of each program in a moment. But just as an overview, SSDI can also pay certain dependents of the recipient. And that's basically because with SSDI or Social Security Disability, you become entitled by paying in, by working. So you insure not only yourself as a disabled individual, but you can also potentially insure your dependents. SSI pays only the disabled individual. And that's basically because SSI is a needs-based program. In other words, it takes a look at a person's income and resources to see if they also meet those criteria in addition to the requirement that they meet the Social Security disability criteria. So with that overview, I'd like to present a side-by-side comparison of both of the programs. As you can see on the left-hand side, Social Security disability is funded in a certain manner by taxpayer contributions into FICA, into Social Security and Medicare. On the right-hand side, SSI is funded by general tax dollars. In other words, it's not funded by the same funds that fund the Social Security disability, retirement program, etc. So SSI does not require that an individual pay in to Social Security to become insured. And that is why most children qualify for SSI. So let's take a look again at the left-hand side and Social Security disability. You become insured, like I said, by paying into the system. The benefit amount is based on the person's average lifetime earnings, which means the contributions they make through those earnings. With SSI, like I said, it's a needs-based assistance program. The benefit amount is set by Congress every year, and we're going to look at that in a moment. But that benefit amount is also determined by a person's income resources and their living arrangement in certain situations. And like I said, we're gonna get into that. SSDI pays benefits to disabled individuals who are unable to work. We do not look at their income and resources. You can basically be a millionaire and draw Social Security disability benefits if you've worked and paid in enough to become insured for that benefit. With SSI, it pays disabled individuals who are unable to work, and like I said, who have little or no income and resources. And we're going to get into the income and resources in detail, but basically it's at the level where you would qualify for Medicaid here in the state of Louisiana. And that's basically why you automatically qualify for Medicaid if you're approved for SSI, because the criteria, the income and resource criteria is almost identical. So Medicaid, or the state of Louisiana, automatically sends the individual that Medicaid eligibility card when their computer picks up that they're receiving SSI benefits. So it's that simple, it's that easy. You don't have to solicit that benefit separately when you qualify for SSI. On SSDI, the benefits for workers and adults disabled since childhood. In other words, you must meet insured status or have paid in or have a parent that has, or spouse that has paid in long enough for you to be a dependent. So for Social Security disability, there's also a 5-month waiting period. That 5-month waiting period is usually absorbed in the time that it takes to make the medical decision, depending upon when your condition is determined to have started. And that's determined by the Social Security Disability Agency that reviews all the medical records and approves you for benefits. With SSI, benefits for children and adults with little or no income. Once, like I said, no benefits for dependents, however. And the good thing is that if you're approved, there's no waiting period. Now, I wanna mention right here also that the first month of eligibility, if you're approved for SSI, is the month after the month you have filed. So if I file for SSI today, the first month that I will be paid, if I'm approved, is starting November, okay? And that is very important because if I'm thinking about filing for SSI disability, I don't want to put it off until the end of October, because if I'm approved and I go ahead and file November 1st, if I'm approved, the first month that I'm going to be paid is December. So you see what I mean? That's one reason not to procrastinate when you're filing for benefits. Make sure you get that application in before the end of the month. For Medicare, as I already mentioned, you get that automatically after 24 months. You don't have to solicit it. We automatically know when you've been on our rolls for 24 months, and we send you that red, white, and blue card automatically. It brings with it all the benefits that anyone else on Medicare gets, whether it's because you're retired or whether you're receiving disability. It's all the same. And once again, Medicaid is immediate with SSI. So I hope that provides a good comparison of the two programs, because like I mentioned, there is a lot of confusion as to which disability programs people receive or might be eligible for, etc. Moving forward, let's go ahead and take a look at something else that's very important with these disability programs, and that's the definition of disability. I like to make this very clear because Social Security does have a pretty strict definition of disability. What I mean by that is that Social Security is not a short-term disability program. You have to have a condition that's expected to last, or which has already lasted 12 months or more, or unfortunately is expected to end in death. In other words, a terminal condition. A lot of people file for Social Security disability not realizing this strict definition of disability. They may have a pretty serious condition, but by medical standards, it's probably going to be temporary. Let's say it's a broken hip. It's a seriously broken leg. Yeah, it's serious right now. You're not able to work, but that condition is expected to improve to the point where you may be able to continue working ahead of a year lapsing. So that's the difference. So a lot of times you hear it said, it's very difficult to qualify for Social Security disability, or you always have to be denied once before you're approved. I hear all of these things. And I think the reason behind those cases that people are referring to is what I explained, that people don't go in knowing that it has to be a condition that's expected to last 12 months or more or end in death. And the other thing is you have to be unable to do any type of work, not just your usual work. We look at the inability to do any type of work, and the way we determine that is we look to see if that person is able to engage in some sort of substantial gainful activity. We call it SGA for short. It basically describes a certain level of work activity that a person is potentially eligible to engage in or is engaging in. Sometimes people come in to file for disability benefits because of a condition, and they still are working. They are suffering. They're in pain. They have to drag themselves in every morning. They're missing a lot of work because of this condition. But unfortunately, if they are grossing a certain level in their paycheck, their gross paycheck, we would deny them and not even send their case for a medical decision. In 2021, and the figure changes every year slightly, but this year, if a person is grossing $1,310 or more a month, that's considered substantial gainful employment, and it assumes that the person is not going to qualify or not going to meet the definition of disability for Social Security benefits. Now, that's not to say that once your level of work activity is reduced, let's say you have to cut down your hours at work because of your condition and you're grossing under that amount, you can come back into us. In many cases, we can just reopen your application that's been denied. And you have to do that within 60 days. But that's how we're going to be looking at work activity if you come in and or working at the time that you want to file for benefits. As you can see, for blind individuals, that level of gainful activity is a lot higher. It's $2,190 this year. SGA, or substantial gainful activity, also comes in once you were receiving benefits in a certain capacity. I'm going to get into working while receiving benefits a lot more in depth in a little while. Let's go ahead and continue by saying regarding work that Social Security will also consider the impairment the person has, the person's age, education, and past work activity. And let me explain that a little bit, because I think that has a lot to do as well with the denial rate on Social Security disability applications. Let me give you an example of a person who has, let's say, a college degree, but for whatever reason is doing a job where they have a lot of physical activity, a lot of physical exertion. Let's say they are a project manager at a construction site where they have to basically get in and do some type of physical labor, or maybe climb to inspect or to keep an eye on the project. They come into us, they say that they're no longer able to work because of this severe back condition. Social Security is going to look at that level of education. They're going to look at that person's age and potentially, this is a general example, potentially say that we're going to deny that individual because there are other potential jobs in the general economy that person could potentially engage in because they're still of a young age and they have a college education, meaning that they can potentially do a job where they don't have to do any type of physical activity, perhaps, a desk job, something of that nature because of that education level. But if you turn that around and that individual that's a construction worker has a severe back injury, has only perhaps like a barely a high school education, didn't get their GED, didn't get that certificate for a high school education, Social Security may approve that individual if that individual can't potentially do other types of work that don't require a higher education level. So it's really, you can't compare apples and oranges, so to speak. A lot of times people like to do that and say, hey, my neighbor was approved. He's got a back condition. I wasn't. I have a back condition. Well, what are the differences in age? What are the differences in education level? Those are the determining factors in some cases for approvals or denials. Okay. Let's talk about the definition of disability for children, because I've spent a lot of time talking about work activity and how that plays into Social Security disability, but for adults. But for children, work is not an issue. Children don't work for the most part. You may have a child actor here and there, but aside from that, I can't think of too many children that might work. So we don't look at the ability to work at all. What we do look at is the child's impairment and their ability to perform what we call age-appropriate tasks, their ability to reach those developmental milestones at the pace that non-disabled children might be reaching those milestones, the ability of that child to learn in school or in preschool at the rate that other children are learning. That's what we look at. We also look at premature babies. We approve a lot of babies, for example, that come through Children's Hospital and a number of other hospitals in the area. If those premature babies are born at 1,200 grams or less, they are pretty much approved immediately. Now, what happens is that we reevaluate them after a year to see if they are still considered disabled because they are still experiencing some conditions that are connected to the fact that they were premature and had some issues. In other words, after a year, we want to see if those children are now thriving, if they are meeting those developmental milestones. In many cases, they are. In some cases, unfortunately, they're not. So they would stay on our disability rolls. We do continuing disability reviews for all individuals receiving disability benefits, no matter what the disability is. However, depending upon the condition that they have been approved for benefits, that determines how often the disability is reviewed. There are some conditions that unfortunately they're not likely to improve, but not being likely to improve doesn't mean they can't. So we still review those, but those conditions that tend to improve, such as with the premature babies, those we evaluate a little bit more frequently. Let's talk about non-medical requirements, because remember, for both programs, SSDI, Social Security Disability, and SSI, you have to meet the medical criteria, but that's not enough. You have to meet other non-medical criteria. Let's start with the ones for SSI. Those are, as I mentioned previously, income and resource related. You have to have very low or no income, very few or no resources. And when we're talking about children, we're also talking about the income and resources of the parents. So we're going to talk about parental income in a moment. But for now, we're going to look at that income and resource of the child. Now, you're probably thinking children usually don't have income or resources. Well, that's true, but sometimes they do. Sometimes they have child support. We have to take a look at that. Sometimes they have resources. Maybe a relative died and left that child some type of inheritance. We have to take a look at that. The good thing is that no payment into Social Security as far as working is needed, whether you're a child or an adult, even though I'm focusing on children right now. You must also meet residency and citizenship requirements. And those are kind of vast, but just keep in mind that you have to reside in the United States or a territory of the United States, and you must be a citizen or a national of the United States. If you're not a citizen, we look to see if you're what we call a qualified alien. There are some vast criteria for that. I always encourage people that if you're here legally but are not a citizen, just file for benefits. We'll do all the necessary researching to see if you meet that immigration status criteria and all of that, because it is very vast and very complicated. But just keep that in mind. Never not file for benefits, because even though you're a legal citizen here in the U.S., because you think you may not qualify for benefits. So that's an important one to remember. I mentioned the federal benefit rate for SSI. It changes slightly every year. I want to say by at most $10 or so each year. So that gives you an idea. But this year it's $794 a month for an individual or for a child who qualifies. We also have what's called the couple rate. If you are married or if you live in a common law relationship and you are both disabled, we take what's called a couple disability claim. And if you're approved, you're paid a total of $1,191 a month. You're probably doing the math and saying, okay, that's not quite $794 for each. And you're right, it's not. It's figures that were set by Congress, and those are the rules and regulations that we at Social Security abide by. So, like I said, those change slightly every year. The SSI amount of $794 or the couple rate, as I explained, could be less depending upon the person's income. And also living arrangement. We're going to talk about that in a minute. But let's go ahead. We've talked about the SSI non-medical requirement. Let's talk about the Social Security non-medical requirements. So in this situation, you appear to meet the medical criteria, but do you have the non-medical requirements? So those would be, remember, you do have to have paid into Social Security by working and paying in out of your paycheck. So you have to have the equivalent of 5 years of recent work into Social Security paid employment, We call that about 20 credits. By the way, credits are the same thing as quarters. We've just changed the terminology. But it is roughly about 5 years of work. So if somebody comes in and we're doing, like our basic pre-interview questions, we say, so have you worked at least 5 out of the last 10 years and paid into Social Security? If they say, yeah, I think I have, then we'll go ahead and go forward and then start, looking further into that work activity. If the person says, no, I know for a fact I have not worked in the past 10 years and paid into Social Security, well, that gives us a heads up that they're probably not going to qualify for a Social Security disability, but they might qualify for SSI. But let's go ahead and keep looking at the non-medical requirements for Social Security disability. Your age comes into a good part of the requirement here. If you are under age 31, the requirement of time paid into Social Security is less the younger you are. And you might ask why. The reason is that we understand that the younger you are, the less you've been able to work and pay into Social Security. You may have been in school. There are many reasons. You may be 20 years of age with a severe disability that's bringing you in to file for benefits. So at age 24, for example, we only require that you've worked and paid in for 1.5 years prior to becoming disabled. If you're age 29, we only look for 4 years prior to you becoming disabled. This is unlike, people that are over 31 years of age. Then we're looking for that 5 year out of the past 10 criteria. But yeah, most certainly, this is a good reason why younger people need to know the importance of paying into Social Security. I do outreach at colleges. I'll set up my table with my Social Security, tablecloth. I have my computer, and a lot of these young college age kids pass by and they look at me like, what is she doing here? I haven't graduated. I've never had a job yet. I'm working towards that. What is she doing here? I'm nowhere near retirement, because that's what everybody thinks. But if I manage to get them over to me and talk to them, then they understand, oh, okay, yeah, it's important for me to work and pay into Social Security and not get paid under the table. You've heard that said. Getting paid under the table. Yeah, well, you may get a pretty hefty check because you're not paying into Social Security, you're not paying taxes, but you also have nothing to show for that work on the back end if you become disabled. You could very well have a 24-year-old who hasn't had that much time worked, who has already started a family, and if something happens to him or her and they are no longer able to provide for their family, they only need 1.5 years of contributions into Social Security for Social Security to be able to pay them a modest check. Yes, a modest check, because they haven't paid in that long, but nevertheless, it's a check. And also, we could potentially pay their dependents a check as well. And keep in mind that if we pay dependents on your record, it does not reduce your benefit amount. It's in addition to your benefit amount. So I can't say enough about educating, your young adult kids, your grandkids about this. It's very, very important. So unlike retirement benefits, you do have to have a recent connection to contributions. Like I said, we look to see if you've contributed in within a certain period prior to becoming disabled. With retirement, it's not the same. We don't care when you contributed in, as long as you have the quarters needed when you go to retire. So, and heads up, Susan, we could also do a retirement seminar for your audiences later on and talk a little bit more about that, how that works. So anyway, let's go ahead and continue with other ways that children can become entitled to Social Security benefits. We know SSI is the #1 way for disabled children, but they could also become entitled as a dependent of a parent that is disabled or retired and receiving benefits. They could also qualify as a survivor of a worker who unfortunately is deceased and had worked and paid into the system. So I like to mention this so that when you hear of certain cases, that sets off a light bulb when you're, talking to friends or whatever, and they mention the case of someone who passed away. Say, hey, have you thought about filing for dependent or survivor benefits for those children? So we can help each other out by learning about these programs and really being an advocate for each other by learning what basically qualifies you. I don't expect you to be a Social Security representative and know the facts. I just like to educate the public so that, like I said, it sets off a light bulb in your head when you come across certain information. Disabled adult children. This would be a situation where a child becomes entitled on a parent's record. That parent is either disabled or retired. Normally, that dependent child stays on that worker's record until age 18 or 19 if still in high school. That's when we consider them dependents. If they're past those ages, they're considered adults for our purposes. They're no longer considered dependents of that worker. However, if that child attained a disability prior to age 22, we can potentially allow them to continue getting benefits on that parent's record, no matter their age. So you may hear of a 56-year-old disabled individual who's never worked because of a severe disability that they've had since prior to age 22, and they're getting benefits on their parents' record. How could that be? This is how it could be. It's a very good provision under the Social Security law that gives that adult child a very good opportunity to continue getting those benefits, because a severe condition attained prior to age 22 has probably not allowed that individual to work or create a Social Security record for themselves. So it's a wonderful, wonderful benefit that is available to some disabled adults. I promised you I'd talk a little bit about parental income and SSI. Strictly SSI, because remember, for Social Security disability, SSDI, we don't look at income and resources, but for SSI, we do. So we look at the parental income, whether that income is earned or unearned, meaning whether that parent is working and has income, or they may be receiving a VA pension. That would be considered unearned income. Any other type of pension, anything like that is unearned, meaning that it's not obtained through work activity. So either way, we're going to look at it. Some of that parental income is excluded depending upon the other children in the household who do not receive SSI. We look at that because, we might have a child filing for SSI with a parent that's working and has a good income, but let's say there are 4 other children in that household. That parent's income is going to support not only the potential SSI eligible child, it's also going to support the 4 other children. So we can't count all that income against that SSI potentially eligible child and say, hey, you have too much income coming into your household, because that income is not all for that child. So keep that in mind as well. So parental income, I'm going to give you a general idea of what that is. If there were 2 parents in the household last year and they have earnings, that $794 SSI check starts to be reduced if the total parental income reaches $2,475 a month gross. Okay. We can assume that the child is not going to be eligible based on the parental income if the total parental income reaches $4,041 a month. Okay. So anywhere in between those 2 figures, there is some leeway for the child to get some SSI benefit. But if the parental income goes over that $4,000 level, they're probably not going to be eligible. Okay. Likewise, these amounts go up very slightly each year. So that's why I feel comfortable giving last year's figure there, because by the time you know it, we're going to be into 2022. But it's going to be about in that level there. Once again, if there are more than 1 child in the household, there's even more leeway there. So go ahead and file that application, and we'll look at all that criteria in depth. You don't have to go in knowing that you absolutely meet this criteria or not. We're going to do that for you. We're going to figure that out for you. And I just want to mention that this is strictly an example. Filing an application is really the only way to actually get a formal decision of eligibility from us on eligibility. So just keep that in mind. But I'd just like to provide some general guidelines on income. Also keep in mind what I said previously. The criteria is pretty much what the Medicaid eligibility guidelines might be, if that gives you a better picture of what we're looking at. Just to give you an idea as to what we count and what we do not count as income, and what is considered earned and unearned. I've given you a side-by-side there. I'm not going to read those out to you, but it just gives you a good idea of what's considered earned and unearned income. And I do like to talk about exclusions, because some of that income is excluded, whether it's parental income or the income of the individual. I like to list that there. $20 a month off of unearned income, and the first $65 a month of earned income. So the way I like to explain working and receiving SSI is a little less than half of what the individual, I'm not talking about parental income, I'm talking about an individual who's eligible for SSI and wants to work. A little less than half of gross earnings are going to start to reduce that SSI check. And that's kind of a hard concept to get people to grasp at first, because all they really hear is, if I work, my SSI check is going to be reduced. And that's true, but even though an SSI check might be reduced a little bit because you're working, the total of that reduced SSI check plus what you're working and earning is still going to be more than just the SSI check in most cases. Okay, so we'd like to make that clear. We also exclude things like food stamps, home energy assistance, help with utilities from a, assistance organization. That's excluded. We don't count that. So certain aspects of child support are not counted. So like I said, it gets to be complex. Just know the general criteria and leave the rest to us. We would rather you submit an application to us and have you submit it and not meet the criteria, as opposed to not filing because you think you don't qualify. Okay. Counted resources, bank accounts. And this is for SSI strictly, remember. Bonds, stocks. One car is excluded, but the value of the second car we look at. The cash surrender value of life insurance policies we look at. Any property where you do not live. So I'm jumping over to the right-hand side. What we exclude, the home you live in. So if you have property at home that you live in, that's totally excluded. Your one car is excluded. Burial plots, those are excluded. And some resources set aside for burial. Keep in mind that's different than a life insurance policy. It has to be like a burial plot or prepaid burial plot or something of that nature. That is not counted. So the individual resource limit. So if I'm an individual filing for SSI, my limit is $2,000. If I'm part of an eligible disabled couple, it's $3,000 for both. And then for a child living with one parent, the total resource limit is $4,000. If it's a child in the household with two parents, the total resource limit is $5,000. So that gives you an idea of what may affect or may not affect eligibility. Something else that affects eligibility is living arrangements. We look at where the individual or the child lives to determine payment amount. Once again, because SSI is a needs-based program. So if you're an adult receiving SSI and you live in someone else's household and you do not contribute your share of the household expenses, we look at that as in-kind assistance from the household. And your SSI payment might be reduced. So you're living in your cousin's household and you're not contributing towards food or shelter expenses. We realize your cousin is not handing you $100 or $200 check each month, but in fact, you are getting that in kind. You're getting free food and shelter. So SSI reduces your SSI check because you're getting that income from the household in the form of food and shelter. Adults and children are different. A child living in the parent's household, we don't expect the same contribution. We assume that that check for the child is going to help with the household expenses. So that doesn't apply. However, if it's a child recipient living in someone else's household other than the parents, we do expect them to contribute. And if not, it's looked as if they're getting in-kind assistance as well. Adults and children residing in an institution. If you are in a medical institution where Medicaid is paying for more than half of the cost of stay, the maximum SSI pays is $30 a month. And that's simply because Medicaid is paying for the cost of your shelter, and your food while you're in that institution. Now, there is a provision that if it's a temporary stay, in other words, not throughout a month, that doesn't apply. This is if you're in an institution for a long period of time, namely more than 30 days, okay? And another important feature is that if a child is an inpatient in a hospital, the parent's income and resources do not apply or count against the child's eligibility until that child goes back home. So I mentioned that we approve a lot of premature babies, or preemies as they're called. A lot of times the parent's income would not otherwise allow those children to qualify for SSI, but because they're in the hospital, they do qualify for Medicaid through SSI, and they qualify for a $30 check. That $30 check is basically for incidentals, you know, extra things that the child might need, clothing, something of that nature. But in the situation that I described, the child, the preemie, will qualify. And then unfortunately, when they go home, if the parental income exceeds those levels that we talked about, or if their resources exceed those limits that we talked about, then the child is no longer eligible. But by all means, the benefit and of course the Medicaid is a big, big help while they are hospitalized. And I talked about the in-kind for children living in someone else's household other than their parent, so I'm not going to cover that again. When a child attains age 18, we no longer look at parental income or parental resources. So a lot of children that are disabled are newly eligible at age 18. They may not have been eligible strictly because of the parental income, not because they weren't disabled and met our criteria. It's only because of the parental income and resources. So a lot of times, once the child reaches their 18th birthday, they can file an application, and we will make a medical determination determining if they meet the adult criteria for disability. Okay. If the child continues to live in the parent's household, remember what I just explained. They do have to contribute towards those household expenses, or their SSI payment is lowered. SSA as an agency conducts those disability determinations, as I mentioned, at age 18. Let's say a child has been on disability since prior to age 18. If they reach 18, still on our rolls, we still have to do a review, and we're gonna see if they meet the definition of disability for adults under Social Security criteria, since they are now an adult. So sometimes, yeah, a child might meet the criteria as a child because we're not looking at the ability to work, but once they become an adult, they may fall off the roll because we may find that although they do have a disabling condition, they can do some type of work. You know, I don't have to tell you that disabled individuals can be productive and can do some types of work in many cases. In many cases, they're not able to, but in some they are. So we do take a look at that. Talking about work, a lot of people are interested in going back to work now that they've been on benefits. The condition may have improved a bit. They may be feeling a little better. But a lot of people are hesitant to try and go back to work because, rightfully so, they're afraid to lose their disability benefits. What if I try to work, but my condition acts up again and I find that I can't continue to work? Well, have I lost my benefits? What happens now? Well, we want people who want to return to work or attempt to go back to work to be able to try their ability to work without the fear of losing their benefits. So if you try to work and can't continue to work because of your medical condition, you can start your benefit again, or you can restart your benefit without having to file all over again. Okay. It's called expedited reinstatement. And most people are eligible if they worked. Sometimes you work for a while, you're doing well. You may be earning at a point where you can't get a check, but if you stop working because something happens, you can come back to us and say, hey, look, I was doing well. I was on my own. I was earning a good living, but my conditions acted up again, or I have, a condition that has coupled with the condition I already had. You might qualify for that expedited reinstatement and not have to file a whole new claim over again. So those are just some of the protections that we offer to help eliminate the fear of trying to go back to work and fearing losing your benefits if you can. Social Security disability and SSI have totally different rules on work while receiving disability benefits. So I've provided a publication called Working While Disabled, and I believe Families Helping Families is going to provide that to you after the presentation. It gives you a lot more details about the requirements for work under each program. They are different, so please make sure you're aware of those, and make sure that if you're considering going back to work, that you are looking at the work rules for SSI if you're on SSI, or for SSDI if you're on SSDI, or for both if you get both. SSI is based on the recipient's income and resources. So about half of the amount of earnings you have will reduce your benefit dollar for dollar. So it's not going to kick you off our rolls, but it will reduce your benefit, because remember, we have to look at any income and resources because it's a needs-based program. So I believe I explained it in this way before. About half of what you gross after a little exclusion there off your earnings, about half of that is going to reduce your SSI dollar for dollar. So let me give you an example. Let's say you are grossing $300 a month. Technically speaking, we're only going to look at about 150 of that as actual earnings for you. And that's what's going to basically reduce your SSI check, about $150, probably less. But keep in mind what I said, even though your SSI check might be reduced by about $150, you're going to have the remainder of your SSI check plus what you're earning. So you're still going to probably have more money at the end of the month between the two. So keep that in mind, do the math so that you are not discouraged from working under SSI. SSA has a number of what we call work incentive programs that make it possible for people under both programs to work and still receive payments. And what I mean by this is that these work incentive programs may not even count half of your earnings under SSI. We have The Ticket to Work program. We have what's called the PASS program, Plan for Achieving Self-Support. Those are the initials, PASS. And if you become part of those programs, if you join those programs, you may be able to work and get your full SSI check without any reduction for a certain period of time. So by all means, learn about those work incentive programs on our website. And those will prove very, very beneficial. Remember that they're called work incentives, meaning they're an incentive to go back to work without the fear of losing your benefits. And I'm also including under benefits your Medicare and your Medicaid. Sometimes those are even more detrimental than losing your cash benefits, is losing your medical benefits. So keep in mind that under most of these programs, you get to keep those medical benefits as well. So what you are looking at right now is part of our homepage at www.socialsecurity.gov. Make sure it's GOV, folks. You go to .com, you're going to get some sites that will charge you for information. They'll charge you to help you file a claim, that type of thing. Social Security, the agency, will never charge for an application or for any type of services. So keep that in mind. So you can apply for Social Security, disability, or SSI online. It's by far the easiest way to file. As I said, you're looking at our homepage, click on disability, and it's going to open up the disability application world to you. It's going to explain a whole lot more than I can within a limited period of time. It's probably going to answer a lot of additional questions you may have after today's presentation. And basically just guide you through the application process. You can also call your local office if you don't want to file online, make an appointment to file by phone. In our current environment, we are only taking applications by phone if you don't choose to do it online. Our offices are still closed except for certain limited in-person services. And that's basically transactions that we determine have to be done in person. I want to give you an example of that, like a first-time Social Security card for immigrants. We do have to do that in person because there are a lot of security features with ID that we have to conduct in person. But just about everything else can be conducted over the phone or online. If you have to submit any type of documentation, we provide you with a secure fax line that we have available. So just keep that in mind. And by the way, I'm going to show you how to contact your local office in a moment, but I've also made our toll-free 1-800 number available there should you choose to use that number as well. So if you go ahead and file, I'd just like to show you what you might need. Social Security numbers of the child and the parent, if it's a minor child, if it's an adult. We also have other information that you're going to need. So I'm not going to read those to you, but it also helps to have, for sure, the names of your doctors, hospitals, clinics, the names of your medications, that type of thing, readily available. And that's mainly why I say that filing online is so easy, because you can, run and take a look at your medicine bottle while you're in the process of completing your application online. It's real easy to do. So let's go ahead and let you know that the online application, whether you choose to file online or to complete it online or to file via phone with a representative, the process is the same. You're not alone in doing it. Even if you submit it online, Your application is reviewed by a Social Security representative locally. They will contact you if any additional information is needed, or for example, if we see that there are any other entitlements available for you or your family. For example, if you're filing for yourself and we ask on the application, do you have any children that are under age 18? And we ask you to list their names and dates of birth. That lets us know that that's a dependent that can potentially be entitled on your record if you're filing for SSDI. If you're filing for SSI, remember, you don't have that capability, but we look at all that for you. You don't have to know the ins and outs of eligibility. I call it a smart application. We ask you questions that key us in on other programs under Social Security that you might be eligible for. I always say, a lot of times people say that we're very nosy, that we ask so many questions, but it's for a reason. It's to see what other entitlements the person might have for our programs. So go ahead and try and file online if you have that capability. Some people say, I'm not too good on the computer. Hey, I bet you know someone who is. Help them help you file online. You don't have to wait for an appointment. Sometimes if you call to file by phone, it's not immediate. You don't file right then and there. You're given an appointment for a future date. And with everything being done via phone these days, sometimes our wait it can be substantial, weeks, maybe even 3 weeks, maybe even more in some areas. So please consider filing online. It's advantageous to you because your information gets into our system almost immediately. Therefore, all the quicker you will get a decision going forward. So the case is reviewed in the same way. The other advantage is that you can check the status of your application online because you've submitted it to us online, and that's an advantage too. Disability Determination Services, or what we call DDS, is the state agency to where your medical information goes, and they make the disability determination. That claims representative, if you file with a representative, does not make your medical decision. They basically just know what information is needed as far as the non-medical criteria, and they know what medical information to ask of you so that they can submit it to this state agency. They are an agency that has a team of doctors and other medical professionals and disability specialists that make the disability determination based upon the condition that you have. So if you have a physical condition and it's an orthopedic condition, there are certain doctors on staff that are going to take a look at that are knowledgeable on the ins and outs of orthopedics. If you have a psychiatric condition, then a psychiatrist or psychologist is going to look at the condition surrounding your case. So just to give you an idea of how that works, once they get your information, they may need to send you an additional questionnaire, for example, about your daily activities. What do you find you can and cannot do? You would complete that questionnaire and send it back to that state agency. It's important that you do. If you don't, they may not have the necessary information that they need to approve your case. They may need to schedule what's called a consultative examination, meaning an additional test might be needed in order for them to get the precise information they need to approve your case. they may be looking for one nugget of information. For example, how far can a person with a severe back condition stoop? That might not be contained in your medical records, okay? They may need to send you for an examination of your physical ability to stoop or to lift. That will help them determine your criteria for approval. So a lot of people call these a Social Security doctor. They are not on the Social Security payroll as an employee. These are simply physicians that make themselves available should we need a consultative examination, should we need additional information. We know to go to this list of doctors that have available appointments. Now, these doctors have no stake in whether you're approved or denied. They don't even know if eventually you're approved or denied. Some of these doctors don't even know what our criteria is. They're just called upon to say they can stoop this many degrees or they can lift this many pounds. That's it. We get that test back from them, and that's all they know. That's all they have to provide to us. So it's important that a person keeps the appointment. It's paid for by Social Security, so it's no cost to them. And we basically just have to use that information to make that decision for them. So it takes an average of about 90 to 120 days to make a decision. And it can take a lot less if you need to or not, depending on the condition, to go to that consultative examination. But if we don't have enough information on you, that's when we'll need that information. If we do, we may not need that consultative examination. So just let us provide the information that's called upon so that we can make that decision. When DDS makes that determination, we will send you a letter with that decision telling you whether you've been approved or denied. It will let you know why the decision was made. It could be a medical reason, or it could be a non-medical reason. But usually if it's a non-medical reason, your case won't go to get a medical decision. If you're not approved, you're given 60 days to appeal the decision. And please do appeal the decision. It's important that you do. Don't get frustrated and just start over. Make sure you appeal within 60 days. And you can do that appeal online with creating a My Social Security account on our website. My Social Security account is a great account to have. You do have to be 18 years of age or older, but it's basically an account through which you just do your Social Security business. You don't need an account to file for benefits, but if you're 18 years or older, it's good to have the account once you file for benefits, or even if you're not going to file for benefits. As you could see, all the advantages that are available there for your situation. If you don't receive Social Security benefits, you can do a lot through that account, such as requesting a replacement Social Security card. You can review how much work you have engaged in so far and how many credits you have. It's also good for those of you listening, already thinking about retirement, because it will let you know what estimates you have for retirement. It also lets you know your estimates for disability if you're thinking about filing for disability under Social Security disability. So keep that account in mind. Highly recommended for you to keep track of your Social Security information. So as I mentioned, our offices are closed for in-person visits with a few exceptions, and Social Security would have to determine it to be an exception. But like I mentioned, our representatives are answering local office phones remotely and assisting the public with anything from questions to filing applications and transacting any type of business. But in certain cases, Social Security office managers will make an appointment for people to go into the office. But to find your local office phone number, it's easy to do. You basically just go on our website and go scroll down to contact us, click on contact us, and then you're going to find an icon for office locator. Click on that, and there you will see the screen that I'm providing for you there, called the Social Security Office Locator. If you put in your zip code and hit locate, it will provide your local office phone number, and it will also provide your local office fax number in case you have to fax any information into your local office. And with that being said, I am happy to answer any questions that you all may have. And I believe Dave Lynn is going to facilitate that for us.
Okay, I want to tell you thank you, first of all. I appreciate how clear you speak and how detailed you are when you cover the information. I want to apologize too, because I didn't anticipate the need for this question, but are you prepared to or able to take questions if we individually unmute individuals, or would you prefer that I direct the questions that are in the chat to you?
I prefer that you direct the questions in the chat to me, and I want to keep in mind, please keep in mind that it's hard to answer particular situations. I can answer those questions generally, but each individual situation is very unique. And I'll try and give a general answer, but keep in mind that that the best route to take is to contact your local office that way they can look at your individual record, pull up that record and give you some more specific details. But by all means, I'll be glad to give some general answers.
Excellent. Yeah, that's hard when it's personal and all of the little details matter. Definitely. Okay, great. So to get started, the first question that I saw in the chat is, why is it so difficult to be approved when there's documentation of injuries and someone hasn't been able to work within a certain period of time? That is kind of a specific question. And I know you discussed the amount of work that has to be put in and the different cases where somebody might be approved, but could you maybe shed some more light on that?
Yeah, let me comment, and you're absolutely right. I mean, each case is unique. You mentioned the question, the participant mentioned that they did provide necessary documentation of the condition or disability, but they were still denied. That's why I said it's very important to appeal a decision if you disagree with it. If you feel you have provided adequate documentation, and I don't know if you meant that Social Security said that you didn't provide adequate documentation. I'm not sure what the situation is, but that denial letter should have specified the reason for the denial. Other than that, appealing the decision is crucial, because at that point you can say, okay, you're saying that I did not provide this documentation, but yes, I did, and here it is. The appeal protects your application as well. It's better than becoming frustrated and then just finding that I have to file again. This condition has not gone away, and having to file again a few months down the road, you lose benefits in that way, depending upon the program you're filing for. But I definitely urge you to file an appeal if you're still within your 60-day appeal period, and or go back to that denial letter and take a look at exactly the reason for that denial, and then approach Social Security again. Hopefully you're still within your appeal period. I hope that
Great.
helps somewhat.
I think that was a pretty good explanation. Thank you. To kind of piggyback off of that question, are there advocates within the Social Security Administration that families can talk to better understand that process and to maybe more clearly articulate their needs and their concerns with a denial?
I wouldn't say we have advocates for that particular purpose, although, you know, a family is welcome to contact us at any time with questions. I find, and we do have an organization that is funded by Social Security when it comes to people wanting to go back to work. That one's called WIPA, Work Incentives Planning Assistance. Just FYI, they do presentations. That might be something that your organization wants to provide in the future for those interested in working, and I'll be glad to provide their contact information. But going back to your specific question, you know, you can call us at any time with questions, but no, you know, other than questions, I think organizations such as Families Helping Families are very, very knowledgeable about guidance with our programs. As Dave Lynn mentioned at the beginning of or the start of the presentation, we have done presentations for them, for their organization. We do not expect them to be Social Security representatives, but they do a wonderful job at providing guidance for families, and basically just leading you in the right direction, whether that is to contact us or to, you know, file an appeal, as I mentioned, in that way.
Thank you. There is some information in the chat for anybody who's interested about additional resources for someone who's applying. I know that Wallace has offered in the past to give as much information as he can and clarity as he can. And then it looks like there's maybe a representative with one of the Healthy Louisiana plans too that does some of that. Another question that was put in the chat is, if a person is receiving SSDI and they have a baby, how do they apply for benefits for their dependent?
Absolutely. Contact your local office or that toll-free 1-800 number, and they will be able to set up an appointment for you.
Excellent. That's good to know. A few other questions. How does Social Security treat scholarships and college grants in regard to the $2,000 resource limit for Social Security or for SSI?
I would say it depends on the grant and what it covers and what it pays for. There are a number of exclusions for students as far as income is concerned. So I don't see those as being a reason for a lot of denials under SSI, and certainly not under Social Security Disability. So I would say, you know, don't shy away from those. I would say contact your local office. and maybe provide the specifics of the scholarship or grant that the individual has. But in my experience, I haven't seen those to be a problem.
Great. Can you tell me about how much time you have? We have just lots of questions. I don't want to miss anybody. And I know that you've said that the best way is to contact someone directly, but while we have you, tell me about how many more minutes you have.
I would say about 10 more minutes before I have to jump on another meeting. I'll be glad to answer any questions that we can get in.
Excellent. Let me see what else I can come up with from the chat. So we have someone who's talking about an individual who went in for a consultative exam, and it doesn't look like the doctor performed any of the tests on the form, but indicated in the report that there were no limitations. What can someone do to get another consultative exam, and will Social Security pay for that?
Let me ask this. Well, let me answer it in two ways. I don't know if the person was already denied as a result of that. If they were, once again, the appeal, that is your basis for appeal. Okay. If you're still undergoing the disability process, Social Security is the one that determines the need for another consultative examination, and they may not feel the need to do that, but you can feel free to submit any other documentation that you can obtain that counters that decision that the consultative examination doctor made. Depending upon at which point of the process you were in. I hope that helps.
That was, I would say, a pretty good explanation under the circumstances. So another question is there a cheat sheet or something that tells school staff how to complete the information when we get forms from Social Security? Some of the items are a bit confusing, or the students have just moved in and we don't have the info or know the student yet. Can you speak to that?
Dave Lynn, I am so sorry, but there was a lot of background noise.
Yeah, I apologize. Let me try to read that again. Is there a cheat sheet or something that tells school staff how to complete the information when we get forms from Social Security? Some of the items are a bit confusing, or the students have just moved in and we do not yet have the information or know the student.
Okay, and I would be curious to know what kind of forms are received. You mentioning students, I'm guessing it's some type of school. I can't say we have a specific cheat sheet prepared for that. What I would recommend is, depending upon the types of forms that are being sent and at what point is the person already getting benefits? Is it a reevaluation? On our website, I would put in the search engine just what topic you're looking for, and you can read up on what information Social Security looks for at that particular point in time. If it's a reevaluation of the disability, it's going to tell you a little bit about what we're looking for. In other words, it's going to let you know that we're looking for how the condition has changed since the last evaluation. For example, it's not going to want to know everything from the beginning. That's the type of information that you'll be able to read up on. If it's a form about whether the individual is still a student, because they're looking to see if they can keep them on the parent's record, it's also going to tell you what we're looking for in that situation, generally speaking, also on the website. A lot of times the forms themselves will explain a little bit on the back of them. But the other option I offer is also just calling your local office. If you're having a little difficulty knowing what is being asked, and you know, call the local office and say, hey, I got this form, or I'm helping an individual with this form, and on question number 10 here, I really don't know what you mean. We will go ahead, we will pull up that form and look at number 10 and do our best to answer that for you. Absolutely.
Okay, great. I want to apologize to all of our attendees. If I've missed your question, I'm very sorry. It sounds like maybe we could get another webinar out of Ms. Maria, the same one even possibly, but I do have.
I just lost you.
We would love to have you do another webinar if possible, because we have so many questions being asked. So that would definitely be helpful.
I would love to do that.
I'm sorry. Thank you so much, Maria. It's Susan. I think our reception may have just lost. Oh, there's David, she's back.
Technology, huh?
Yeah,
it's unpredictable at
so much now.
I want to remind everybody that when we finish the webinar, you're going to be prompted to complete a post-event survey. We'll share this information with Ms. Maria in hopes that it'll help with future webinars. You're going to receive an email as well with the link to the same survey, just in case you miss it. We want you to tell us what you thought about the webinar and tell us if you need to hear it again or you know someone that needs to hear it. Share with us ideas about other webinars or webinar topics you might be interested in. It's free to gain knowledge and learn about resources in.
Okay, looks like we lost her again. Thank you so much, Maria. We really appreciate your time, and we're going to let you go. Wallace has put the evaluation link in the chat box if y'all would like to give us an evaluation and tell us your thoughts, give us some ideas of other workshops, or let us know what you might need. And we appreciate your time, Maria, and we will talk to you later. Thank you so much.
Thank you.
Gotta unmute myself. Thanks to everyone who attended, and thank you for your patience. I know it was a long webinar and you had lots of questions. We will do our best to have this again in the future and try to get more information. And remember, there's lots of publications out there that can help too. Thank you so much. Bye-bye.